Health experts are tonight telling Kenyans that there is no reason for alarm, despite countries like China and the United Kingdom registering an increase in the number of COVID-19 infections amid relaxed measures. According to Dr. Patrick Amoth, the Acting Director General of Health, Kenya already experienced a spike in the number of infections driven by the Omicron variant earlier in the year, a variant which is now leading to the current scenarios in cities in China. And as Raquel Muigai reports, Kenya's positivity rate stands at 0.9% after only 9 positive cases were recorded on Tuesday.
It is barely a week since the Ministry of Health revised the COVID-19 regulations in the country, and the news that several provinces in China are under lockdown due to a surge in COVID-19 infections is one that is least welcome at the time, especially among those who choose to continue wearing their masks in open public spaces.
So hata corona ni kitu inapitia hewa. So tuendelee kuzingatia hiyo sheria ya barokea mpaka wakati itatangazwa imeisha duniani, alafu tunakuwa declared free.
Vile inaendelea kuongezeka, ndasema tu pia watu waendelee tu kudungwa hizo shindano vile walikuwa wamesema. Watu waweze kutii vile serikali ilikuwa imetuambia. Yaani tuweze pia kujichunga.
According to China's National Health Commission, 3,507 new locally spread cases had been identified in the latest 24-hour period. The commission stating that a fast-spreading variant known as stealth Omicron is testing China's zero-tolerance strategy of finding and isolating every case and sometimes conducting mass testing in cities and towns, which had kept the virus at bay since the deadly initial outbreak in the city of Wuhan in early 2020. The scenarios, though a reminder of the early days of the pandemic, are of little concern to the Ministry of Health.
We are on the lookout for the numbers, but remember we had our upsurge in December, January. So if it is the same variant, there's no cause for alarm. What happened is because China imposed so much restrictions, and because of Omicron variant, in terms of its presentation, many patients are asymptomatic or they have mild symptoms. So it's possible that 1 or 2 people slipped in, spread along the community again asymptomatically, until now they are seeing the surge of numbers like we did in December, January.
According to Professor Thumbe Mwangi, an infectious diseases epidemiologist, the reasonable best-case scenario of smaller regional or seasonal outbreaks, or worst-case scenario of new unpredictable variants building into repeated virus waves is possible. However, there is a bigger question that the country should be concerned about.
Have we got enough ICU beds? Have we got enough oxygen? I think those are the really critical health system questions that we can focus on during these peace times and make sure that our health system is ready in the event that we had new rising cases, inclusive of need for hospitalization.
Even as the government keeps an eye on the happenings in other countries,
the question of personal responsibility is really important. So as if you're with your aging parents, you sort of need to be careful the way you're interacting with them in the event you have new cases coming in, that you do not pass it on to them, because as we can tell, even if you have history of vaccination, you still can get infected, and sometimes those infections could end up being severe infections.
In indoor settings, we still promote use of masks because of the nature of spread of most of the respiratory infectious diseases like TB, COVID, amongst others.
At the moment, the ministry is upscaling the vaccination exercise in the country, as vaccines have proven to be a preventive measure against severe COVID-19 disease. Raquel Muigai, Citizen TV.